Good morning, esteemed colleagues. We are starting our work in the UCMC, and first event today is the fifth medical mission of Canadian doctors. The speakers are Oleh, Antonyshyn, head of the adult Craniofacial program at Sunnybrook, Khrystina, Waler, Director of Humanitarian Initiatives, Canadian-Ukraine Foundation, Oleh Verba, Colonel of Medical Service, Ministry of Defense of Ukraine, Viktor Hetmanczuk, President of the Canada-Ukraine Foundation, Ihor Fedirko, Director of the Craniofacial Surgery and Dentistry Clinic at the Ministry of Defense Main Clinical Military Hospital, and Captain Andrey, Sidorenko, U.S. Army. Good afternoon to everyone. I'm Khrystina Waler. I'm the Director of Humanitarian Initiatives, Canadian-Ukrainian Foundation. On the 24th of February, the team of surgeons from Canada arrived. That is our fifth mission. I will just moderate this session. I would like to invite Oleh Verba, the Colonel of Medical Service, Deputy Head of the Medical Department of the Ministry of Defense of Ukraine. Esteemed ladies and gentlemen, good morning. I believe our today's meeting is the sign of friendly support and solidarity with Ukrainian people and its armed forces. Ukraine is surviving through difficult times. The challenges and threats which we are facing are dangerous for the whole democratic world, but we feel the permanent support of the leading countries of the world, including Canada. Our cooperation has become much more active now. For the fifth time in Ukraine, we are hosting the representatives of organization Canada-Ukraine Foundation. They will have their next medical mission from the 24th of February, 5th of March this year, and this will be at the National Military Medical Clinical Center, main military clinical hospital. The goal of that mission is providing consultative assistance to Ukrainian medical experts on reconstructive surgery for treating Ukrainian servicemen who were wounded during the Ihor. There are 26 foreign medical workers who will participate in the mission. Also, American doctors will join Canadian colleagues in this mission. They are planning to organize specialized training, master classes on reconstructive surgery, with the participation of local Ukrainian doctors, nurses, and other specialists who work in the sphere of health protection. All the necessary medical equipment which will be provided by Canadian doctors after the mission ends will stay with the military hospital. During their stay in Ukraine, the American doctors will visit the Military Medical Clinical Center in Irpin. From the leadership of medical service of the Armed Forces of Ukraine, from the servicemen who are now serving in the east of Ukraine, I would like to thank Canada for their comprehensive assistance now in these difficult times. Thank you. Now I would like to invite the President of Canada-Ukraine Foundation, Mr. Viktor Hetmanczuk. Thank you. I will start somewhat different topic today. we will, the people will be talking about medical mission, but I would like to remind that a year ago I was here and I emphasized that Canada-Ukraine Foundation is also looking at master classes for nurses, and today we are starting basically a new work here in Ukraine where we'll be changing the nursery, nurses' work via knowledge. In Canada, since 1989, the Ministry of Health has been funding the programs to support foundation of preparatory practical grounds for clinical work based on evidence-based medicine, which means that we will be bringing to Ukraine new methodology of practicing, and will be teaching that in academic institutions, and then gradually will move to hospitals. The task of the program is developing the standards of assistance, practical use of evidence base, transferring knowledge in the sphere of nursing, and also filling in the gaps in research and reducing the expenditures of the hospitals. We'll have another press conference dedicated to that, and I will announce which will be the first 3 or 4 institutions which will have this program. The China, Italy, Belgium, Australia are now also in this program. We are very much interested in helping not just to doctors, but also to nurses. Thank you. Thank you, Mr. Hetmanczuk from Canada-Ukraine Foundation. We are grateful to the Ministry of Defense and the medical hospital for being ready for cooperation. This is almost 3 years ago when we met for the first time, and immediately from the very beginning when we offered such cooperation, such master classes, when we offered cooperation in science and exchange of opinion, they were immediately ready. The General Verba and the previous head of the department helped us a lot, and we really appreciate that assistance. I would like Dr. Oleh Antonyshyn to take the floor so that he explains a little more about our cooperation.
Thank you very much. 2 years ago, we first arrived to this country with the idea that Canadians could provide help to those people who suffered because of shellings in Maidan or in the ATO area. Since that, we had 4 very successful missions. This is the 5th one. The missions are organized as follows. In Canada, we announce that we would like to enroll the volunteers, volunteering surgeons and doctors who would like to be, who are interested in coming to Ukraine and carrying out surgery operations, especially those whose specialty are restoration of upper limbs and in craniofacial surgery. This time, for the first time, we have representatives from the U.S. Military medicine and U.S. Army. in course of previous missions, we carried out provided operations for 127 patients during the last 2 days. When we had arrived to Ukraine, we saw more than 80 patients and made appointments for surgeries for them. This all will be surgeries of craniofacial cases and upper limbs. Also, we very closely cooperate with very professional Ukrainian medical, military specialists, and we are very pleased to cooperate with the dentists, very experienced dentists from Ukraine, and I think we will provide big help to those people who suffered in the ATO area. Thank you, Dr. Antonyshyn. I think that that here in Ukraine, medical specialist has got even bigger experience here, because in Canada we do not have such big challenges. We are in different situation than people here, and for us, it is a very precious experience, and we have been working with very good Ukrainian specialist, Dr. Ihor Fedirko, who is head of the Craniofacial department in Ukrainian military hospital. Thank you, Khrystina. Good morning, Ukraine. I would like to say that this is once again when Canada demonstrates its devotion to Ukraine and its willingness to provide real help and assistance to our country. I'm happy to welcome my colleagues, my friends, and those doctors, those surgeons who now are preparing to the start of the surgery operations in the hospitals. Once again, we are providing help to those soldiers, servicemen who suffered because of cranial trauma, cranial injuries, and upper limbs injuries during each previous mission. Our Canadian colleagues usually ask how they can assist more. So during previous mission, our Canadian colleagues applied to Canadian government for bigger support to medical missions of Ukraine, and missions number 3 and 4, more than 700,000 Canadian dollars were delivered for procurement of equipment. The majority of that equipment was donated to the craniofacial surgery clinic and traumatology military clinics within the military hospital. This was a very precious assistance. During this mission, we plan to have more than 40 patients, but this is not final figure, because expectations might be higher, because people come every day to our consultancy center, and we will provide help not just to the soldiers but also to civilian population who resided along the contact line and was injured because of shellings. That's why we expect more patients. This time, for the first time, we have our American colleagues from the U.S. Army. I think that the United States has one of the strongest armies in the world, and I expect that the military medical service is also very strong. That's why it will be interesting for us to work together to discuss the most topical issues. Thank you to all the participants, and I expect that the output of this mission will be as successful as during the previous missions. During the last 2 days, we met with and provided consultations for the previous patients, 127 patients. Some of them will require further surgery operations, and we take this rather optimistically. Thank you, Dr. Fedirko. I would like to add a bit. All Canadians arrive here as volunteers from civilian hospitals. We are very happy that this time we have 6 persons from the U.S. Army Medical Unit, and I'm pleased to give the floor to Captain Andrey Sidorenko, U.S. Army. Thank you, Khrystina. Dear colleagues, I would like to express my gratitude to Ukrainian party and to Canadians who are our neighbors and partners, not just in military area but also in military medicine. We had arrived from Germany, and we represent the U.S. command of American Army in Europe. Our attempt is to understand how we can assist in providing help, what is needed to study the needs and to study the experience of our Ukrainian colleagues. Also, we would like to understand how we can assist in the area of rehabilitation. And we are very grateful to our partners who invited us to participate in this mission. Thank you very much. As all the speakers today mentioned, that all 3 countries are happy to cooperate with the joint aim to provide assistance to our servicemen. We contribute a lot of effort to help to those who put life on the line defending Ukraine. Our mission is ready to provide more consultations during current week, and we are happy to announce that those who would like to apply for consultation, you're welcome. Now the questions, please.
Sorry, Dr. Antonyshyn. Ihor Antonyshyn. I'm sorry.